Producer help desk is there to answer any questions. Let me go back there. And these are the newsrooms that I was talking about. The newsroom, Jarvis, and Jarvis Wrap. How many of you see the Jarvis Wrap on Mondays? Because we send them over to everybody. It has the latest news about everything new in Jarvis. And it also gives you information about maybe some of the job aids that you may need, like Part D overview, reference guides that are there, anything that's being uploaded and updated, specifically because you know that the formularies are changing. There's so much going on with drugs being covered, not covered, that one's covered, that one's not covered, now we cover this one, now that one. So to remain very, very well aware and educated so that you can educate your members because you know what's going on, right? You're gonna be able to give them that information right away. So readiness page on Jarvis includes agent playbook, checklist, quick reference guides, sales tool guides, and also key AEP tools that you can use for retention, for example. And I know retention is big this year, right? So plan features, I can say proudly, we have 14 million members, right? Yes, we are the largest and we continue to be the largest. You know, and if you see here, 10.2 million Medicare Advantage members, 4.3 Medicare Supplement members, and 3.5 Part D members. So we are still strong and getting stronger in what matters most for our members. What matters most for our members is that they have access to care, that they have access to a PET scan, a CT scan, something that they, you know, can cost them like $5,000, right? If they don't, if they have a lower MOOP with us, right? The most that they'll pay is $800, but guess what? With United Healthcare, they'll pay zero on labs, annual physicals, primary care visits, mammography, colonoscopy. Worldwide emergency is unlimited, and our members are able to call directly to be able to arrange payment to that country. Okay, very different than what you see with other carriers where they need to keep their receipts, submit claims. You know, they can also do that. If it's allowed for us to pay directly, we are able to do that. Tier 1 and 2 continues to be zero in LA County, and routine eye, dental, hearing exams are also at zero, and gym membership is included in our plans, and virtual visits. When we talk about zeros, we're talking about zeros in the entire nation. So we continue to save our clients a lot of money. Doesn't matter where they live. We want them to also have access to our 1.3 million doctors. Yes, you heard it right. 1.3 million doctors and growing. So very large network, reliable still. We still have some of those networks here in LA, right? Like Cedars, UCLA, Regal, we have PIH, we have Carelon, we have Optum, and all of our plans, right? Just to name a few, okay? And I think in Loma Linda and St. Joe, St. Jude, Providence, right? Facey, Tepa, Torrance Memorial, all that, all those different medical groups. Enrollment eligible conditions for chronic plans. How many of you knew that we have chronic plans? Okay, great. A lot of agents don't know that we have chronic plans. And as a matter of fact, we still have the OTC healthy food benefits included in these plans, which is very, very important to know that although there are a lot of changes with the SBCCI program for DSNP plans, that doesn't affect us. We continue to keep our members and keep giving them those benefits included without having to re-verify again next year, right? Our members continue to receive these benefits. So what's good about the chronic plans with United Healthcare? What's good is that they get zero insulins. The deductible, it's not included for insulins or anyone that has LIS. And very low deductible in other, different categories of different medications. Very broad and robust formulary. And we continue to provide that if the client has diabetes, cardiovascular disease, or chronic heart failure. Now, we also have a chronic dual C-SNP plan, okay? It's not a D-SNP, right? It's not a D-SNP plan, and we don't have D-SNPs in LA County, but I'm sure that if you sell in Vegas, you sell in other states, you're gonna see D-SNP plans with United Healthcare. So I can tell you that whenever you see a C-SNP plan that is a dual chronic, they need to have a chronic condition, but they also need to check, you also need to verify that they have full Medi-Cal. And just let them know, right, that they have a lot of richer benefits if they come to this plan. You also need to check the network. Make sure that the doctors are in there because it is a more provider-specific type of plan. Now for Part D, I can tell you that there's a lot of changes with the Inflation Reduction Act. How many of you have heard about what has happened with the Inflation Reduction Act? Well, let me tell you, it is very beneficial for our members. For 2026, they're only going to pay $2,100, and that's it, right? And with United Healthcare and the carriers, or if you notice with United Healthcare, we went from paying in 2024 43% towards that